before. You've turned my life around. Know I'm a shining star. Last year by this time I'm daddy. Me this car, me go to but I'm a planning. I know what I could do, more routine I have me.
Yeah, praise is always good. All thanks to the Almighty above.
I'm focused.
Nortey by nature. Kind of made it slipped into the seat. Ultimate Health on Joy 99.7 FM. So the past couple of weeks, we've been seeking to understand, comprehend the menstrual cycle with Dr. Michael Macarthy of the Sinel Specialist Family Hospital. Last week we tiptoed virtually into his hospital, where he launched an interesting facility, wellness spa for pregnant women, of course, but generally for everybody as well. Today we intend to wrap up on the menstrual cycle, talking about painful, heavy, irregular periods and beyond. If you have any questions, concerns, experiences, 055 11 11 997. Those are the healthy buttons to push. But right now, I've got Dr. Michael Macarthy in the studio. Doc.
Hi, good afternoon.
Right. Live. If it was Lexus Bill's show, they'd say, dilate. Great to have you.
Thank you.
All right, and last week was a good experience. How's it going with the float spa?
Oh, it's awesome. It's awesome.
Right.
I mean, it's bringing relief.
Okay.
Just on Thursday, one of my clients was saying, I have this pain on my shoulders and the upper back, pregnant lady. Mm-hmm. And she went to have the neck and upper body massage, and it was awesome for her.
Oh, great.
She got some relief.
Okay.
I think it relieved the husband from having to do the massage.
Oh,
and
I see. Okay.
I think it was good.
Right. Okay. So we want to wrap up if we can. There's so much to talk about when it comes to the menstrual cycle. We've done a lot. We've talked about even the psychological toll of it.
Exactly.
On the girl, on the woman, and so on. Preparation. Schools, parents, families should be prepared for this all-important event, right? Which will shape your life in so many significant, salient ways. But today, let's talk a bit about painful periods. That's the dysmenorrhea.
Exactly.
Right? Painful periods. Now, I guess women, maybe even men, in association or by association, hear period and they expect pain. Okay? The last time we went to great lengths to even define or describe pain properly, whether it's subjective or actual pain. But painful periods, since it has a name, dysmenorrhea, then it must be something that is common, familiar, and well classified. What do we mean when we say painful periods?
Right. During menstrual periods, during the menstruation time, there is some amount of discomfort. Mm-hmm. This ranges from just minor discomfort that the woman may cope very well with, can still do her normal activities and everything, to a very severe form of actual pain where she cannot function in her normal capacities for a certain period of time. It could be a whole day or two. So it's kind of like a range of different experiences that different people would have. Mm-hmm. They may have a similar experience with each period, or they may have, slightly different experiences with each period.
Okay.
So this may occur. It could be as cramps. It could be as burning sensation. It could be as pain in the thighs, in the lower back, in the pelvis, and so on.
Right.
So it's quite a little bit of a range of different things that could happen.
Okay.
But about 10% will have such severe pain that they cannot function during those 1 or 2 days.
All right. If you're one of that, unfortunate 10%, do share with us what you go through and what you've been doing especially to cope, right? It's very interesting what women do to cope and what they've learned and where they learned it from, right? When it comes to their menses and other things, right? So do you go through painful periods? Now, Doc, let me ask, so is this an assessment, an appraisal done by you, or are we taking the woman's subjective view of what is painful?
It's both.
All right.
You see, we would want to divide the pain, after having described it in the way we just have, want to also divide the pain into pain that is, let's call it natural or without any secondary cause.
Okay.
And then the pain that comes as a result of some other disease condition in the body. So we'll call one primary dysmenorrhea.
Okay.
And we'll call that maybe starts with just normal. And then the other one that is caused by some other pathology, could be a pregnancy, could be a cyst, could be fibroids, could be endometriosis, things like that.
Okay.
So separating those two, usually for primary dysmenorrhea, the woman will tell you the symptoms. And so those are the symptoms we need to take. There's no real test to say, no, your pain is more, or your pain is less, or yes, it is true that you have pain.
Okay.
Pain comes from what she's experiencing. So we need to listen to her history.
Right.
When did the pain start?
Okay.
Is it pain that she's been having all along? Or is it pain that is of new onset?
Okay.
If you get a 25-year-old and she's just suddenly starting to have pain, that may signify that there is a secondary cause.
Okay.
But if you have somebody who's been having pain all along, it may just be that she's trying to find ways to cope and is not really able to cope.
Okay. All right. So you share yours, but from what Doc is, presenting, then you need to know your body. You need to be monitoring your body, right? You need to be learning about your body, and you need to be able to communicate about your body and what you experience, right? Sometimes that is in itself a difficulty, right? How to tell the doctor or how to tell somebody what you're experiencing, right? Some find that difficult, but if that's a difficulty, we'll talk about that in a bit. But the doctor is saying that he's going to take into consideration what you say you experience.
Exactly.
Right? And then, of course, his own assessment of your situation, both physically and otherwise. If you have any questions, concerns, 055 11 11 997. Those are the digits for the WhatsApp line. We're live on Facebook and YouTube. This is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05, we are live with all the important, salient health issues, such as your menstrual cycle. Right. So that defines it, all right? But, of course, you should, if you have any discomfort, present yourself to a health personnel or a doctor.
Well. So if you evaluate and you are finding that this is the pain that you usually get, it's not a new pain that has suddenly come, but it's a pain that you usually get with your menstruation. It's tolerable. You are managing it. It's not affecting your daily activities. Then you just manage it yourself.
Okay.
Could be with warm pads, with walking, with physical activity, or with over-the-counter analgesic medication and so on.
Okay.
If you, however, feel that you're not coping with these simple measures, then you would want to go on and seek for help.
Okay.
Also, if you've not been having pain and suddenly you're now starting to have pain, after many years of having had your menses, you're not having pain, and now suddenly you're starting to have pain, that tells you that there may be something else going on.
Okay.
Rather than just being, let's call it like a normal pain.
Okay.
So
right.
Those are the things. We are not expecting everybody who has menstrual pain to turn up at the clinic.
Okay.
Yes.
All right. That's what the doctor says. You can put him out of business by listening to Ultimate Health, right? It's not everybody he wants to come. But yeah, don't normalize pain. Don't just say it is pain and that is how it has been and that's how it's been for my friend or my auntie. He's also made an important clarification that you should be able to distinguish, or he would distinguish between that which is secondary, caused by something else, and that which is primary, just the pain of the menses itself. You need to know what is going on, and you need professional, qualified assistance to verify what is going on. If you have any questions, concerns, share with us. Okay, this one is not about menstrual cycle. It's about the song I played. Good afternoon, Nortey. I really like the song. Papa Ansa from Latte Equapim. All right, okay, that's your cycle. Right. 055 997. You can get in on the discussion. Menstrual cycle. Painful, heavy, irregular periods and beyond. We're trying to wrap up on the menstrual cycle so that you can have a breather, right? So, Doc, so that's painful period described, defined, or classified in a way. But you mentioned, lower back pain and all that. All of these can be part of the presentation.
Yes.
All
and
right.
not only pain, there are other things that also go with it.
Okay.
Some people get nausea, some people
Okay.
get vomiting, some people
Right.
get diarrhea. And these are all part of the things that are happening during the menstrual cycle. And so that may make the pain worse because other things that are adding and going on.
Okay.
So obviously, if you're not sure what's going on, you're not certain, a hospital visit is not out of place.
Okay. Good afternoon, Oye in Afienya. Yeah, I almost say Afienya in Oye, but hey, spot on. She's the one whose daughter, right?
Yes, that's right.
Was done by daddy.
Exactly.
Right. Okay. Oh yeah. Great to have you. So okay, we've understood that pain. It can involve many other things. Nausea. Check it out and be sure. Are they one and the same when we start moving on to the heaviness of the flow, or to start talking about heavy periods? Right. Heavy sounds heavy, but. What do we mean when we say heavy periods, Doc?
Right. So now medically we have termed all the abnormal types of bleeding.
Okay.
We've put them into one group called abnormal uterine bleeding.
Okay.
So bleeding that is abnormal.
All right.
It may be heavy.
Okay.
It may be more frequent.
Okay.
It may be coming at the wrong time.
Okay.
And so on. So we put all those things together as abnormal uterine bleeding.
Okay.
And then we try to assign a cause to each of the abnormal uterine bleedings. When it comes to heavy bleeding, what is too much bleeding?
Okay.
First, the woman should evaluate herself and say, okay, I think I'm bleeding much more than before. But that could actually be very difficult because one tends to accommodate to that amount of bleeding that one has. And so you see people who have very heavy bleeding and they tell you that, oh, I'm fine, I'm actually coping very well. But then she's actually bleeding more. So that can be quite challenging. So something which is more quantifiable could be, most people would change their pads not less than every 3 hours.
Okay.
If you are changing your pad every 2 hours or less, then it means that you're probably bleeding too much.
Okay.
Because most people would change their pads after 3, 4, 5 hours.
A unit of measurement here, a useful one is
could be how often you are changing your
how
pads.
often you're changing your pads.
Yes.
Okay.
Yes.
Could it be related to whether you're using the right pad? Because I know they are light and so on and so forth.
Yes,
Right.
yes. I mean, some people will tell you that, look, I want to change every 2 hours because
okay.
I want to, feel more comfortable and so on.
Okay.
But if your pad is soaked and you have to change it every 2 hours, you are
Right.
changing every hour. If
All right.
otherwise you stain your clothes,
no longer-
and that is telling you
It's no longer a choice.
that there is something
Right.
going on. So if you have somebody who comes and says, look, I use 2 pads plus Pampers at the same time and I still stain myself if I don't change early
2
enough.
pads plus Pampers.
Then that tells you that, no, there is something going on because she's putting all the mitigating measures in place.
Wow.
But she's still being overwhelmed by the rate of flow of
Sounds
blood.
like Accra rains.
Like Accra rains,
Oh.
yes. It's just too much.
So there are women who are actually experiencing these things, but rather than report them, they are taking, should I say, their own measures, and it may mask the fact that something is wrong.
Not
Or-
is normal.
Okay.
It's normal. The men are even worse. I mean, men will manage their symptoms until it really gets out of hand. And it's normal. Your periods are getting heavy. One pad is not making it. You realize that you have to change your one pad too frequently. So let me just put two big ones, two very highly absorbent ones together. So I can stay 1 hour instead of 30 minutes. Well, let me add some Pampers to it, so that I can go 2 hours. I'm going for a program. I need to, sort myself out. So it's an adaptation to the problem. And a lot of these conditions that cause heavy bleeding come up slowly. So there's a little change each month. And so they're kind of adjusting to it, know. And it's when it then becomes beyond what they can manage. She puts all these things on, goes to bed, and still has to get up every 2 hours to change. She gets up and all her bed clothes are soaked with blood. Then she realizes that no, something else is going on here. I better seek help.
24 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living, this and every Sunday, 2:05 with me, Nortey by nature. I'm speaking with none other than the one and only Dr. Michael Macarthy of the one and only Sinel Specialist Family Hospital in Tema Community 10, right? Yeah, the junction now is called Sinel Junction.
Sinel Junction, you got it right.
Sinel Junction. I mean, if you take Uber, anything, say Sinel Junction. Very soon it will become Michael Macarthy Junction, right? But
maybe.
But he's been doing some good work with us over the years and over the past couple of weeks as well. We've been seeking to comprehend the menstrual cycle. It's a whole range of things. Today, you may hear us speaking or focusing and zeroing in on the menses itself, but it's a whole range of things, and we've been doing that over the past couple of weeks. We're seeking to wrap up. So if you have any questions, concerns, 055 11 11 997. We're live on Facebook and YouTube, and shortly I will activate the phone lines. Good afternoon, Doc. I am having irregular menses. My cycle is sometimes 29 days, sometimes 31, sometimes 40, 41, 44. Okay. That's last week's lottery draw. All right. So I'm having cramps as well as waist pain and pelvic bone pain at my right side. I don't have a name and age, but this is what we've been presented, Doc.
Yeah, interesting. So
sliding scale.
Yes, there are different things all coming together. Remember, we are human, and the body works as a unit, and so different things are coming in, and there may be interlinked challenges and problems. So she's having it irregularly, and she's having the discomfort as well. So that could be something like endometriosis causing this kind of thing, and having ovulation challenges as well. And so she's having this irregular bleeding, and then she's having the pain as well. So getting a clear history, doing a clear examination, doing ultrasound scans, trying to see what is really happening.
You may have several things at once
that may be related.
That may be
things
related.
That may be related. Yes, all put together. But obviously she has irregular periods because 29 all the way up to 41. 44, that's a difference of over 15 days. So obviously that is quite interesting.
Quite a wide error variance, as we'll call it in statistics. It's quite wide, and I would call for a recount. But Doc is actually saying you need to be assessed properly. Because several things may be going on, and this may be changing the goalpost when it comes to the number of days and what happens and so on and so forth. So definitely he confirms and emphasizes you have irregular periods, but the reason or the cause is what he's talking about that needs to be investigated properly and appropriately.
Exactly.
And I dare say what? Can I say urgently? No.
Urgently, yes. Some of the problems can be challenges that could be life-threatening. If you, depending on the age of the person, depending on what kind of symptoms she's getting, what are the other risk factors.
She says she's 29.
29, okay. So we would then try to evaluate and try to find out the history. Is there a component of fertility issues? Has this person had some surgeries on the uterus already? And so on. So it will require some nice evaluation to try to get to the bottom of the challenge, yes.
Okie dokie. How come some people are voting backwards? I've gone past it, but there's a message here. Hi, Nortey. I go through this time of pain every month, dysmenorrhea. In fact, I suffer vomiting and diarrhea as well. It's so excruciating. I normally experience it on the first to the second day. I don't usually bleed, but the pain is intense. Doc.
Yes. So here, you see what we're describing. The person gets this on the first and second day,
right?
And probably the subsequent days are more manageable. Right. But it looks like she has this on the peak days where a lot of the hormones are happening, the local hormones in the uterus, and she's talking about diarrhea and vomiting as well as the pain. So it's like you are being hit by 3 arrows all at the same time.
Right.
So sometimes not just the cramps or the uterine pain, but having diarrhea, having vomiting as well.
Okay.
And then this puts the person out of commission if it is going for lectures, if it is going to work, if she's at a frontline position, maybe in a bank or in a shop or something. She just cannot be at the front line.
Okay.
So we need to understand this. Sometimes we just think of it as pain. No, there's much more to it.
So it's not the woman that's been too soft, too sensitive.
Not at all.
Real deal.
Not at all. It's real.
Real McCoy. This is trouble.
It is real.
It can stop you from functioning.
It can stop you from functioning. You are not comfortable. You are not at your peak. You are being knocked down by these various things that are going on.
Okay. Wow. All right. Okay. I'm tempted to ask. So all of these validate and justify intervention and investigation.
Yes, there should be some investigation. There should be help. We need to find out, okay, so what can we do to help? Is it an issue that we can use a conservative means like exercising in a week or two before menses?
Okay.
Do we need some medication? Is there something more? An ultrasound scan, simple investigations.
Okay.
And at times going a little bit deeper into the investigations.
Okay, great stuff. If you have a question, concern, experience, 0302216541. That's my phone line, 055 11 11 997. It's my WhatsApp line. I'm live on Facebook and YouTube. Sounding a bit raspy today. Is it the headset or it's my voice? I'm sounding a bit nasal. Apologies, but hey, it's still good stuff. You can only get it here on Joy 99.7 FM on a Sunday afternoon. It's called Ultimate Health.
Joy 99.7 FM.
Right, hello Nortey. How many days will be used to determine heavy flow aside from frequent change of pad? Charlotte.
Yes, so that's the other part of the abnormal uterine bleeding.
Okay.
Generally, we would say up to 5 days of bleeding is up to 7 days of bleeding. 5 to 7 days of bleeding is normal.
Okay.
And the bleeding will be tapering off as the days go along. But if you're having more than 7 days, then that is too long. So we call that also abnormal uterine bleeding.
So another index is
the length,
duration,
the duration
of bleed.
Yes.
Okay,
Yes.
we're learning. Okay.
Yes.
Frequency of change of pads and then duration.
Yes.
Of bleeding. And the number of days you bleed. Okay.
Yes.
All right.
Yes.
Men and women, we are learning. Oh, if you missed it, stand on your chair. Right. Hi, Doc. Oh, you didn't finish your point.
No, that was fine.
Okay. Hi, Doc. I went to the hospital and I was diagnosed with high prolactin. I was given medication to take, Dostinex. Whenever I take the drug, my periods become regular. But whenever I complete a course and stop taking it, the periods stop completely again. What could be the cause of this? I have done both MRI and CT scans, and no tumor was found. This is from Mina.
All right, so she it looks like this lady has had some investigations to try to find out what's going on.
And this is a US number.
High prolactin. Yeah. High prolactin is one of the causes of menstrual challenges.
Okay.
Usually, it changes the menstrual flow, usually to less bleeding, and also affects fertility, by the way.
Yeah.
Yes, the treatment for high prolactin is usually generally medication.
Okay.
And she mentioned one type of medication that could be used.
Right.
But the medication needs to be monitored closely. So it's not just about taking it and then you finish taking it and then your problem is solved. It's not like that. There's something that is causing the production of the prolactin.
Okay.
And so one needs to tailor the dose of the medication to the rate of reduction in the prolactin level.
So you'll be monitoring your prolactin levels
over a certain period of time.
Right.
Some people, you solve the problem by giving them a certain course of medication. After that, they are fine for some time. Others would need a maintenance therapy over a certain period of time. So more close monitoring is important. Sometimes, not to blame the patients, but sometimes when the problem is solved, they disappear,
right.
and then they only come when the problem reoccurs.
Right.
But sometimes you need monitoring to ensure that the prolactin level is within the level that you want it. We're actually maintaining it at that level.
Right.
I mean, some of the clients need a certain amount of medication almost perpetually, well, not perpetually, but over a longer period of time, to maintain the prolactin to a certain point. Sometimes this prolactin issue even requires surgery. And mind you, Nortey, this prolactin problem is not only a female problem. Males also have hyperprolactinemia.
Yeah.
Yes.
Why
and,
look at me in that tone of voice?
And they can, and I mean, it can even result in surgery,
right?
Because the prolactin comes from the brain, and sometimes they are small tumors, and that's why she mentioned the CT scan and an MRI scan.
So she's on the right track.
There could be some tumors in the brain that are causing an elevated prolactin level that will actually require surgery. And I remember I had a client years back where it was the male who had the elevated prolactin and required a surgery to solve the elevated prolactin problem. So it cuts across.
Right. Bottom line, your doctor is doing the right thing. The monitoring and your understanding and your cooperation and compliance is what I guess.
I think we need to retune the monitoring and the maintenance dosing.
Michael, you don't believe the heavy flow on the WhatsApp. I am not going to be able to do this. All right. Good afternoon. I used to have painful periods, but totally disappeared after I had my first child. Not complaining at all, but I've been wondering what explains this. This is from Nanaya in Canada.
Awesome. Right. Problem solved. Doctors no more needed.
Agbina. But is it related? I mean, she's had a child.
It happens to some people. They have primary dysmenorrhea, and then they have a child, and it goes. But let's be careful. I mean, there are a lot of people who have primary dysmenorrhea, have a child, and the primary dysmenorrhea is back after the delivery.
All right.
So yes.
So praise your God, and other people cry their own cry. That's what Michael is saying. Right. Nortey, tell Doc that I will come and say hi to him one of these days in the hospital. I work in Tema Parents. Hey. Oh, this is Oye. Okay, understood. Hey, Oye. You keep doing me like that. All right. Hello, I'm scared it could be menopause because I started my menses at 9. This is the lady who has all the stuff and is 29. We just spoke about, the one that 29, 30, 31, 44, the irregular periods.
Okay, I'm scared it might be menopause because I started my menses at 9, but she's 29 now. It's not likely that it's menopause, though one could have premature ovarian failure quite early on by 30. But obviously this needs to be investigated to find out really what is going on with her.
All right.
And so for her, definitely a hospital visit is warranted.
Okay. Fear in hospitals don't work. So banish the fear. Bind it in Ultimate Health's name. Amen. Nana Diasa is here as well. So we've bound it. All right. Exactly what Doc is saying. I usually stay home on the first day because of diarrhea. Okay, so this one Freps work. Okay.
Yeah,
and
it's a serious problem.
All right. Okay. Good afternoon, please. Hang on. This says, how much does it cost to undergo a fertility test? Comfort in Adan wants to know.
Yeah, testing for fertility encompasses the history of the patient, trying to find out what is going on with her, going into detail what is happening, and then deciding what kind of tests. Some of the tests are laboratory tests. Right. Some of them are investigations like ultrasound, saline infusion, and so on and so forth. So you can't she should just talk to her doctor and let's decide what exactly is required from her.
All righty. Right. Hi, guys. So I heard sexual intercourse just around that time eases the pain. And allows for free flow. Is it myth or fact? This sounds like some suspect. Tom Brown in Techiman. Semolina.
Well, at this point, most women are not that comfortable. They are actually not in the mood for intercourse.
Okay.
And that may not be their preferred choice of solving the problem.
Okay.
And I don't think it will actually solve the challenge.
Okay. All right. Tom Brown, Stay off. Right. 0302 216 541. Those are the healthy buttons to push to talk to Dr. Michael Macarthy of the Sinel Specialist Family Hospital on Ultimate Health. We're talking about painful, heavy, irregular periods and beyond. We're trying to wrap up, but well, we're making progress. Nortey, I had serious bleeding for about 2 years. It was very painful. It was so heavy I started wearing diapers. If not, I could not go out. I was later diagnosed with fibroids in my uterus. I didn't want to have surgery, but it got to a point I bled every day. My doctor suggested I had a hysterectomy, which I did last month. I'm free now, but I have premature menopause. I am 45 years. This is from Judith.
Right. So she's describing a pathway along which she went, and
right.
Yes, this could be what is happening to a person, and it's a nice example.
Okay. Thanks for sharing, Judith. We really appreciate it. Good afternoon, please. I just had my myomectomy about a month ago and trying to get pregnant. Now I do get severe abdominal pain during ovulation. Is the pain normal? And what's that brown discharge that comes during this ovulation too?
Okay, interesting. Just a month after menstruation, I don't think she's had many ovulations within that 1 month. She's had time.
Sorry, just a month after myomectomy.
Yeah, so just a month after myomectomy. I mean, she would have had only one chance of ovulation probably within this period.
Right.
So it seems that she's having these ovulatory problems even prior to the surgery. I don't know from her description, but yes, you can have brown discharge during ovulation because sometimes there is some bleeding during ovulation. And because the bleeding is not a lot, it may look brown rather than red. But it's a good sign if she's actually ovulating. I think that's great.
That's good.
That's one hurdle solved.
All parts in working order.
Yes, everything is working, and at the myomectomy they would have checked her fallopian tubes as well, and if they're allowing her to go on to try to get pregnant, probably the tubes are working. So sounds on the right track.
On the right track. Okay, I know you not to be selfish, so share the myomectomy part with my listeners. What's that?
Right, yeah. One of the causes of the abnormal uterine bleeding is uterine fibroids, as the message said. And sometimes surgery is required to solve the problem of uterine fibroids. And one of the surgeries is called myomectomy, where we remove just the fibroids, get the uterus back into as normal a shape and functional form as possible. And that can actually result in a pregnancy for those who want to get pregnant.
All right. So, hey, I know those of you who wait until I'm at the traffic light, I've left the studio and you didn't explain myomectomy. You see? Michael's done it. Right. Okay. This one is to Samson Laddie. Okay. Right. Let me go up. Good afternoon, Nortey. Is it true that drinking milk reduces the menstrual blood flow?
I don't think a lot of dietary issues can actually change the blood flow or the kind of pain during menstruation. Some people will tell you that when they take certain things, they have more severe pain. Then stay away from those things. And some people will say, when I take so and so, my pain is better. So then go ahead with that. I think you need to experiment a little bit with yourself because we are all so different. And what really works for somebody doesn't really work for the other. So try it, put it down, document it. We talked about the phone apps to track things, and you can write notes in the phone apps on those days, and it will show you
your own electoral commissioner
what is really happening. And then you can tailor something for yourself.
Okay, great stuff. Right, if you just joined us, 42 minutes past your hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. Listen every Sunday, 2:05. We are live. We are talking about painful, heavy, irregular periods and beyond with Dr. Michael Macarthy. Good afternoon, Nortey. Please kindly confirm with Doc whether his facility has a spa that one can attend to for massage. Thanks, Kwame Tema Community 2.
Yes, you can come. That's what we launched last week. We made a lot of noise about this last week. Where we have a spa that you can come in for a massage, for foot treatment, hand treatment, back treatment, muscles, and so on and so forth. For men and women, for pregnant women, for people who have just had a baby, those who have a lot of shoulder and back pain during breastfeeding and so on. So, yes, lot of interesting treatments available.
Confirmed. Spa treatment is called spirectomy. Right. Please, Doc, what test would you recommend for a suspected tubal blockage?
Yeah, so there are a number of tests for tubal blockage. There is the hysterosalpingogram, where an X-ray is used to look at the tubes. There is a saline infusion sonography, where ultrasound and some sterile fluid is used to check the fallopian tubes. There is laparoscopy.
Whoa.
Which also, so there are different things that can be done.
Okay.
And the gynecologist
For different
will determine-
reasons, yeah.
For different reasons,
Yeah.
different situations,
Okay.
and then we'll decide what is needed for you.
She wants to tell her gynae, Michael said use this one.
Yes, he should decide which is
and
best.
he said it
you
on
know.
Ultimate Health.
Yes, because they all have their advantages and disadvantages,
Right.
and depending on what you want to see,
Okay.
you can just do
All right,
that, yeah.
great stuff. Hello, good afternoon.
Hello, good afternoon, Nortey.
Right, who am I speaking to?
Ben.
Ben.
Yes, please.
Right, share with us, Ben.
Please, I wanted to find out, doctor, how true is this? Growing up, we're told that those of us who have strong menstrual flow, normally at birth, you don't go through that pain. But after 3 children, you go through that pain. What's the problem?
Those who have strong or heavy menstrual flow at birth, you don't go through pain.
Sorry?
Repeat what you said. Those who have a heavy menstrual flow don't what?
Go through pain. The menstrual pain.
Okay.
We're told that after birth, that pain stops.
Okay.
But after 3 children, I go through that pain.
Okay. Right. But she's saying after a couple of children, she's going through the pain. But she thought, is it true or not that if you have heavy periods, when you have a child, you will not have pain? I'm
Well,
confused.
our one of our first messages that came in,
Right.
The one who sent the message said she used to have severe pain, and after her first baby,
Yeah.
she no longer has pain, and so that's an example of somebody who has that challenge solved by childbirth.
Okay.
And this woman comes in to say that, well, she has had 2 children and she's still having the pain. That buttresses my point that for some people it is solved, and for others
It's not one
solved.
size fits
Yes.
all. Okay. I have another caller. Hello. Hello.
Hello.
Yes. Good afternoon. Who am I speaking to?
Hello. This is Grandma from Takumona.
Joanna from Sakumono.
Yes, please.
Okay, you're welcome. Share with us quickly.
Now, so this message is so painful. I had a problem that each matter like it comes, I can't stand it. That people even around me will say I'm pushing abortion. So when a doctor said I have fibroid, I even suggested to the doctor to remove the womb because the pain was too much for me.
Wow.
And it's true that the time they move, since the time they remove the womb, I've never had any problem up to today. Even though I don't have a child, I don't mind.
I see. Wow. Thanks for sharing. So she's saying she had a hysterectomy because she was in so much pain, right? She hasn't had a child, but she had it taken out.
Right. I didn't get her clearly, but she said she had a hysterectomy because of severe pain, and she's very satisfied
Right.
with the
Yeah.
result because she no longer has pain.
Right. Okay. Hello. Good afternoon.
Hello, good afternoon, doctor. Good afternoon, doctor.
Right. Who am I speaking to?
Please, this is Abna.
Okay, Abna, go ahead.
Okay. So, Nortey, I'm the one who sent you the message earlier on about the diarrhea and then the vomiting. That's the dysmenorrhea.
Right.
I've been to the hospital to check, and then the doctor told me I had a little fibroid, but it's very minute. So, no doctor would like to do anything about it. But then the pain comes every month. It's so excruciating. Sometimes I usually don't go to work because of that. And also, please, can you ask doctor for me? I used to, during the ovulation, these days I don't usually experience the pain and then the discharge that comes with ovulation.
Okay.
Okay.
Right.
Thank you very much.
Okay, so she's having painful periods. Investigations revealed that there were tiny fibroids. The doctor is reluctant or reticent about any surgical intervention. She still has pain. And then she says these days she also doesn't notice or experience the usual discomfort and the discharge with ovulation? I don't know whether you can say anything to that.
I'm not really getting the question.
Right.
Whether she's just describing what she goes through.
No, what the first part is that a doctor has checked. There are small fibroids or uterine
But he
growth.
doesn't think that those fibroids are the
So
cause
he's
of the
left
pain.
them
There may be
alone.
something more to it, yes.
Right. But she still has the pain. All right. And then
Yes.
she mentioned something, I think, related to, we established that you can have discharge during ovulation.
Yes.
Right. She says now she does not experience that.
Well, so there may be other things going on. She may have adenomyosis or endometriosis, all of which can give pain.
Okay.
Even though the fibroids may be present, fibroids are quite common. And the fact that one has fibroids does not mean that one will have problems from those fibroids. So she may be having other issues as well. Pelvic inflammatory disease, it could be endometriosis and so on and so forth.
Okay.
So I think she needs some more investigations. Okay. Let's check a little bit more.
All right, check a bit more. All right, all the best. Good afternoon, Nortey. I am 24. I have serious dysmenorrhea, and every month my bleeding is usually big blood clots. A doctor told me to have a pelvic scan, and it was discovered I have tiny fibroids. However, the doctor said the position and size of the fibroids cannot be the reason for the heavy flow and big clots. Please ask doc what's the reason.
Yeah, there are other reasons. I mean, endometrial polyps, for instance, or cervical polyps are reasons for excessive bleeding. Some time ago, I had a client who had a lot of investigations for abnormal bleeding, and we said, let's check again. And we found that there were some defects in the uterine muscle which were collecting the blood. And so after the menses is over, the blood still continues to come out, even though she's not having menstruation. So repeated checks, looking again, having a different mindset, trying to really find out in a detective manner to see what is really going on. And then pinpointing what the real problem is really what is needed. And sometimes it's not very easy and simple to find the problem.
And of course, the patient can get frustrated too.
It can be frustrating,
and then they default. All right. I started experiencing excruciating pain at 42. This wasn't the case before. All tests show I'm fine. What do I do? Charlotte, I'll turn 45 this year.
Right. So usually primary pain will start very early, late teens and so on. So having new onset pain at 45 is definitely a call to see the doctor because there is something going wrong, which should be checked at that age. Yes, definitely.
All the best, Charlotte. For me, sex within the week, my period is supposed to come, rather makes it come a few days earlier. For example, if my period is due on Thursday and I have sex on Monday, the period will come on Tuesday instead. Is this normal, and what's the reason? On the Spintex Road.
Well, yes, this could happen. Remember that there are a lot of prostaglandins in semen, and those are some of the hormones that affect menstrual blood flow. So this could change the timing. This could change the kind of bleeding that she gets.
Okay. Please, good afternoon. I had a miscarriage on the 11th of May. Please, what can cause that? Okay, that's a whole program in itself. Please, I'm 45 years. Please, can I come for a checkup? My name is Essie. Can I get pregnant again, and how soon? So she just had a miscarriage 11th of May. She's worried, anxious about getting pregnant again, trying again, and she wants to come for a checkup.
The issue of miscarriage is a very thorny one. It has a lot of different ramifications and undertones. It affects the psychology of the patient. It affects the relationship. It affects her self-esteem. And here she's anxious to get pregnant, so it is affecting that as well. So it's actually a bigger can than we think. So she's right in calling for help, and I think yes, she definitely does need help, so she can get over these things and see what can be done next.
Okay, great stuff. 52 minutes past the hour of 2 on Joy 99.7 FM. We're doing great work with you, our discerning listeners. Some of these questions and contributions,
they are really good contributions. Awesome. Yeah.
Amma from La. Of late, when I menstruate, I feel pains when emptying my bowels, both urine and feces. The canal that leads to it. Okay, I feel pain in the canal that leads to it, all right? It goes after menstruation. What is the cause? How can it be solved?
Now, this sounds to me to to be something like endometriosis, if it's recurrent and in this way. So endometriosis of the rectovaginal septum can cause something like this, and so this has to be checked as well.
Have that checked, please. The lady in La. Not my daughter is 16 years and experiencing diarrhea every month during her menses. Eno from Insawam. Diarrhea, 16-year-old.
Yes.
Every month.
Yes, so this can be a serious problem, especially for the teenagers when they are starting their menses. I find that for some of them, being more physically active in the week or two before menses helps to reduce some of these symptoms.
Okay.
And so that's a good thing to think about.
All right. Okay. Hi, Nortey. Please, I suffer all that has been mentioned. I have done my MRI scan, etc. I was told to do surgery, which I have refused, but resorted to I3C plus DIM. Is it okay? Doc, do you understand that code?
IC3, I don't know what that
I3C
is. Maybe it's a medication or
plus
some
DIM.
kind of...
All right. Okay.
Not too sure what that
All
is,
right.
but if that medication is working for her, if it's a medication and it's working for her, that may be fine. But I don't know about it.
All right. Lots of refusal of surgery. We'll talk about that one of these days. Okay.
Right.
Yeah. Doctor sees you, says you need surgery. People say foul. Tofiakwa didn't, wouldn't, couldn't. Problem persists. We'll see. All right. This one says, good afternoon. I was having heavy bleeding to the extent of using diapers. Seven fibrosis or fibroids were taken from my womb. I'm 45 now, no child, no menses. This is Ifwa. Any comments, Doc?
Yes, she buttresses our point that sometimes menses can be very heavy and we have our mitigating measures. So that's one way to know that you are bleeding too much. Yes, removal of fibroids, 7 of them, that could have been the cause of the bleeding.
Right.
But she mentions that she doesn't have menses again at 45. Could it be that she's starting to get into menopause? Probably.
Right. Okay.
So I don't know whether she still has interest in becoming pregnant.
All right.
But these are the challenges.
Okay. Hi, doctor. I bleed a lot, especially on my second day. I get very weak to the extent that I can't even go to work. What do I do? I'm 88. This is Abna.
18?
88. Hey, sorry. 48. Hey, how did I say 88?
48. You see,
48.
As soon as I see this type of problem after the age of 40, I get worried.
Okay.
Because this type of problem at the age of 40 is different from this type of problem at the age of 20, 25.
Right.
You know, so at the age of 40 plus, we want to be more cautious, looking for things that can cause problems. Some of these things can even be malignant or cancerous.
Let me read the problem again. She bleeds a lot, especially on her second day. She gets very weak to the extent that she can't even go to work and wants to know what to do. She's 48.
Yes. So 48, I want to look for endometrial problems, endometrial hyperplasia, even endometrial cancer, though not very common at that age. Check the cervix, check for polyps. Of course, uterine fibroids are commonest, but I want to look for things that could actually be bigger problems than could just be solved.
Okay.
So at age 48, we need to be more detailed.
All right.
And really go deeply to see how to address the issue.
Doc, we have a heavy flow. It's not painful. It's informative.
It's heavy. It's just heavy.
It's heavy. I'm reading these WhatsApp messages like nobody's business, but they're still
and they're
about
not finishing.
10-9 ahead of me. Hi, good afternoon. We'll try and wrap up with this one. Good afternoon. I'm Sandra, texting from Tema. You see, you wrote testing, and I was going to say. I also have heavy flow on the first and second day, and it lasts for 5 days. I take about the pain. Talk about the pain. I can't stand it. I change pad like 30 minutes. Thanks. I'm 38 years and married, but no child yet. I always take pills for the pain every month. We'll wrap up on this one.
Yeah, I think, again, so for a history like this, it's important to be in the hospital to see what is really going on and try to solve it, because this needs to be solved.
All right. So she's taking... when people say they take the pills, they don't tell you who prescribed or what is going on.
Well, some
they're
of
just
them
buying
are over the counter.
Over the counter,
yes. But you see, even over the counter medication must be taken along certain guidelines, the dosage, the frequency, and so on.
Right.
And if it is not solving the problem, you need to seek further help.
Okie dokie, you need to seek further help,
Yes,
right?
yes, very important.
Okay, we like the fuse with your views. That's what we do on Ultimate Health. And this one says, come on. Good afternoon, Nortey. I'm 42 and still experience painful menstrual cramps. Mostly feel it in my waist and my feet get swollen. Please, is it normal?
Well, yeah, if she's been having this all along, it's not anything new or different. Maybe normal for her, if that same pattern. But as I said, again, at 43, you want to check and see whether there are other things that are coming up, ovarian cysts and so on, to try to rule those ones out.
All right, great stuff. We are tempted to wrap up on the menstrual cycle, but you can see it is flowing, Papa. Doc,
We've not been able to finish all the things
we
yet.
need to get some location out of town and have a camp
And solve all the problems.
and solve all the flow, right? But Doc, it's been awesome having you for what, 6 weeks now?
Yes, about 4 weeks
4
now.
weeks
Yeah,
and a bit.
it's been awesome. Yes,
Right.
I've enjoyed it.
And we thank you for enriching our programming, and we'll come back and look at miscarriage and the other things
Yes,
that
yes.
have come up,
Yes.
as in menstrual matters arising.
Thank you so much for having me over these past 4 weeks. It's
Right.
been a pleasure.
Right.
And I see we've solved a lot of problems for
Yeah.
people, and we are open to solve more.
Okay,
Thank
hopefully
you.
we haven't caused any problems. Many thanks to Dr. Michael Macarthy of the Sinel Specialist Family Hospital, Tema Community 10. Just ask for the Sinel Junction. That's it. The UK folks will say you can't miss it. Right? My name is Nortey by nature. It's been great being here on a Sunday afternoon as usual. Hey, guess what? These days I hand over to this handsome guy B. He can't dance, but he can dance. But the Joy FM pop quiz is up. And it's for families. It's the healthy family feud. But the questions he himself has been chewing. The quizmaster is learning. So I'm out of here. My name is Nortey by nature. Lexus Bill is in now with the Joy FM pop quiz.